All right, I'm going to be inspecting the patient's nose, oropharynx, and things along that. So first thing we're going to look is just palpate, make sure there's no deviated septum along those lines or anything. We're just going to look around the lips for discoloration. We're going to look around the eyes, just seeing if there's any cracking or abnormal dryness of the skin. And then next, what we're going to do is just kind of come in and we're going to look inside the nose, looking at the nasal vestibules. So we're going to ask the patient to tilt their head back a little bit, and then we're going to press down just so we can get a little bit of a better view. Come in into the vestibule and all the way in. And we're just looking to make sure that we can see all the vestibules, or the 3 vestibules. We're going to switch our deals. Actually, use that. Okay. Go to the other side of the patient and tilt their head back again and look inside. Looking to see that there's no discharge or green discharge. They should be like a pinkish red, nothing too flame or fiery or anything like that. And I ask the patient to smile and open up their mouth. Check the gums, look underneath the gums, and then ask the patient to stick out their tongue, open out their mouth wide, looking to make sure that it doesn't deviate to either side, inferring the lesion. And ask the patient to lift up their tongue, looking for the frenulum, making sure that that is normal. And then we're gonna ask them to move down so I can see in. And we're just gonna take this, and we're going to be inspecting the inside of the patient's mouth, the sides, making sure there's no abnormal scarring, leukoplakia, any other thing along those lines. Just constantly keep checking their glands, making sure that there's saliva. And ask the patient to swallow. Everything checks out there. Then with their reflex, that seems to be acting normal. Next, I'm going to depress the patient's tongue. I'm just going to check and make sure there's a gag reflex, and I'm looking for the soft palate to rise. Awesome. Making sure that the uvula doesn't deviate to either side along those lines. Next, I'm going to make sure I get rid of the glove, and we're going to be palpating the maxillary sinuses and then the supraauricular sinuses. Any pain with any of that? No. Okay, just looking for abnormal there, frontal sinuses and the maxillary sinuses. Gonna ask the patient to stick out their tongue again, just looking for the lesion, that it doesn't deviate to either side. We're good there. Gag reflex we've already checked, and no halitosis, so we're good there.